Welcome to Summit Speaks, an interview series to highlight conditions and lift up conversations in Monroe County. This series will lead into the Monroe County Childhood Conditions Summit, or MC3, brought to you by Youth Services Bureau and Building a Thriving Compassionate Community, or BTCC. Please feel free to share this interview using the hashtag SummitSpeaks. Check out our website at btccbloomington.org. I am so honored to introduce Monica Black, a local therapist, to talk to us about the conditions for young people of color experiencing all the different kind of range of mental health issues in our community. Again, I'm Stephanie Solomon. I use she, her pronouns. I work at the Youth Services Bureau of Monroe County. Monica, is there any way that you would like to introduce yourself using identities, affiliations?
Sure. Thank you so much for having me. I'm super excited to be here. My name is Monica Black. I'm a therapist and social worker at IU Health, Riley Physicians here in Bloomington. I use she, her, hers pronouns as well. I'm also a Bloomington native. I was born and raised in Bloomington, so it's just really nice to be able to get to do this with you.
Yeah. So to get us started, let's talk a little bit in general about where is Monroe County doing well when it comes to mental health for young people of color?
Well, I think Monroe County offers several spaces that address mental health for young people of color and youth in general. So the first things I thought of were Meadows Hospital as a safe place if kids are experiencing, suicidal or self-harm or homicidal thoughts or feelings. And there's also the youth shelter as a safe place for youth, and I know that the youth shelter gets utilized a lot by kids involved in different systems like DCS or probation, and just kids that need a break from home or are having a hard time. There are several social service agencies in town who also offer home-based therapy services, but often those services are specifically only for kids and families who are experiencing like a crisis with DCS, kids and families. And, a year ago I took this job at IU Health to be a part of a behavioral health unit within pediatrics, which in design is amazing because people often trust their doctor and the nurses that take care of their kids. And so having that service within the doctor setting often creates an accessibility or a comfort level that sometimes families are intimidated about trying to go to a place like Centerstone. They've never been there, they don't know anyone there, but if you have the trust, and you have the relationship with a doctor or a nurse that has taken care of your kids since they were, born, that can make trying behavioral health, a little bit less scary. I mean, that said, it's my interpretation and feeling and opinion on a personal and professional level that youth of color do not access mental health resources as much as other populations. And there's many, many reasons for that. Insurance is one of the biggest barriers. So if the kids, parents is having trouble getting their insurance sorted out, I mean, that just pretty much closes the door on mental health because mental health is exceedingly expensive as an out-of-pocket cost. And I think there's a lot of stigma around mental health, like, oh, there's something wrong with me, or I'm broken, or, I'm like messed up, I'm a bad kid. I've heard all of those things in the rooms that I sit in. And so I think it's hard for kids who are already othered in a sense of being a kid of color or part of the LGBTQ community to want to add another, thing that makes them different, even though we all have mental health. That's just part of being human, right? The last thing I'll say, and I could talk about this a lot, is there's also a lack of representation within mental health. A lot of mental health providers and social workers, be they wonderful and amazing people, are often white women and sometimes white men. And, you know, that in and of itself can be very intimidating for kids of color, kids that might be struggling, to talk with someone about their most intimate or most vulnerable parts of themselves with a person that doesn't look like them. And so I think that's a huge issue. That's not just a Monroe County issue. That's like the field of mental health in general is a very white space.
Oh, so many good points. Monica.
Sorry, went on a tangent.
Yeah. Well, the next thing that I would love to hear about is tell us about the conditions of not being a white person, of being a young person of color in Monroe County.
Yeah. Well, you know, growing up here, I think Bloomington often likes to pride itself on being a really diverse place. And while that's true in theory, often that diversity is a very transient population that does not stay in the Bloomington area. So what I mean by that is a lot of diversity comes to Bloomington through IU, but then folks are here for maybe 4 years, maybe 5 years, they do a graduate study, they come for graduate school, and then they leave and take their diversity with them. So for the kids that, for the youth of color that grow up here, Bloomington is actually a very white space. And recently I've been thinking about what Bloomington doesn't have, what Monroe County doesn't have that it needs to have, because what happens is when kids have needs that exceed what Monroe County can offer, they have to go to Greenwood or they have to go to Indianapolis for like longer term residential treatment, and that creates, or Columbus, you know, Indiana, and that can create hardship for families because if their child is placed in a facility that's an hour away and they want to do visits, that's not always conducive, gas money, cars, transportation, things like that. So I think the thing that Bloomington really could use is like residential treatment, longer term, not just acute stays like what Meadows can offer in our community to serve the kids here instead of everyone having to get shipped off in a sense to surrounding counties. And so I think, you know, that condition itself, it's like if a kid gets in trouble here and it can't be addressed on an immediate, if they need longer term help, that means taking them out of their community and away from their family. And I don't think that is, you know, always the best solution. I mean, sometimes that's exactly what they need, but not in all cases. So, you know, and I think also like if a youth is struggling with like a criminal issue, right? If they're in trouble with probation, or we don't have a juvenile facility in Monroe County, which is a great thing. Like we don't have a youth detention facility in Monroe County, but again, if a child is in that situation, it's a 2-hour drive where they're placed for their family. And like, again, we're taking a kid who's already struggling, whose family might need a lot of help and resources, and they're getting their treatment or their rehab or they're serving their time in whatever capacity, not here. And so I think that's another thing that I think about. I mean, I think there's always more we could do to create safe and welcoming spaces for youth of color in Monroe County, to reduce stigma of mental health, to reduce stigma of like family poverty or you know, family trauma that kids are dealing with or trying to work through and address. And so that just means accessibility, like low barrier accessibility.
Yeah, I'm wondering, so for folks who maybe aren't interfacing with the mental health community and want to kind of take action on some of what you've been talking about, making mental health services more accessible for youth of color, destigmatizing mental health services, what are some actions that folks can take?
Yeah, so that's a really hard and really great question. And you know, part of, I've been approached with this question a couple of times, and I just have to share, like, part of my knee-jerk reaction to this question is white communities coming to communities of color and going, what do we need to do to fix the problem? Where it's like, we have been trying to tell y'all for, centuries what you need to do. You guys need to figure out the solution on yourself. So there's this like knee-jerk part of me that is like, people of color don't have the answer to like help white communities make their stuff more accessible. You know what I mean?
Yeah.
So that's one side of myself. And then the other side of myself knows that approach is limiting also, and that we have to work together to build bridges and create connections and create communities. So I think it's just important that I acknowledge like that's a part of me. Like when I get asked, what should we do? It's like, I don't know.
Yeah.
What do you think you guys need to do, So I think, okay, logical, reasonable steps. Any mental health services or social service agency in Monroe County should make active, actionable steps to hire a more diverse workforce. Not just the applications that come through the door, but actively seek out and identify applicants who could help their agency on whatever level, in whatever diversity they're lacking. So I think that's an actionable step. I also think Monroe County, I would love to see us have like a youth, like a group home kind of facility in Monroe County. It's another thing that I would constantly come up against, like at my old job at Family Solutions, where kids aren't necessarily needing long-term residential treatment. They're not in crisis. They're not actively having suicidal or homicidal thoughts, but maybe they don't do well in a foster home kind of setting. They do well in group settings. They can follow protocol, but like we don't have anything like that to fit those needs. So I think a grant, I don't know which organization wants to take this on, but applying for grant money on a federal level to create like a group home space for Monroe County's youth would do a lot to kind of meet a need that I don't see us, like there's not many options for group home. Because like some kids just do better in group home settings instead of their home of birth and they don't necessarily qualify for like intensive treatment stuff. So I think that's something that I don't know how to create that, right? Like that's a huge undertaking that, requires funding and a board probably and also all sorts of stuff, but that's a gap I've seen. A lot of us are wounded in relationships and a lot of healing happens within relationships. So if you can help build healthy, positive relationships and connections, a lot of healing can take place.
That is the perfect value for us to end on. Our focus with the Monroe County Childhood Condition Summit is around safe, stable, nurturing relationships and environments. And it's grounded in the value of collaboration.
Yeah.
And so you've given us some actions that allow us to look at the way we relate to build our organizational environments and have a value of collaboration. So thank you so much.
Aww.
Monica, we are so lucky to have you,
Thank you.
as a member of this community doing the incredible work that you do.
Well, I feel the same. So thanks for having me. I really appreciate it. All right.